Woeller here. Hi, everybody. Dr. Woeller here for Great Plains Lab for their complimentary monthly webinar. I am from Integrated Medicine Academy. I'll tell you a little bit more about my academy here shortly. So I thought what I would do with this lecture, this was kind of a large topic, right? Talking about the organic acids test and the GPL-TOX profile and the MycoTOX profile. I mean, we could spend all week discussing the intricacies of these tests. There's that much to know. So how I thought I would approach this is we're going to look at a couple case scenarios and a couple cases as well as a case scenario, kind of brainstorm some things as we go through these cases, kind of get you thinking about things clinically and how these tests can line up. So for those of you who don't know me, I've been an integrative and functional medicine physician since the late 90s, 1998 to be exact. I've been doing a lot of clinical education for Great Plains Lab for many years now, teaching their organic acid test seminar through the GPL Academy, plus just doing webinars, monthly webinars now for many years. I do a lot of public speaking, much more in person, obviously before COVID, but I still do a lot of online. I've been doing education for years. I'm a practicing clinician. I'm co-founder of Integrated Medicine Academy, which is an online training academy for healthcare practitioners with in-depth courses in integrative and functional medicine. I also have a website called Functional Medicine Clinical Rounds, which is a practitioner site, membership site where people can join and consult with us one-on-one. And then my own practice, I've been working with individuals on the autism spectrum for going on nearly 24 years now. Autoimmune diseases, gastrointestinal problems, patients with neurological disorders, etc. So this lecture is going to assume at least that you have some knowledge or background of the organic acid test. Doesn't mean you have to know all of the ins and outs, but at least have worked with it a bit. Same would be said of the mycotoxin, the GPL-TOX profile, but we're not going to go too deep into the weeds here with the biochemistry. I will do an overview of some of these tests just to kind of lay the groundwork here. And then we'll get into kind of the fun stuff when we start talking about some of these cases. So on page 1, right, of the organic acid test, under the yeast and fungal markers, we've got 9 markers. 4 of them are related to Aspergillus mold exposure, where the Aspergillus is colonizing the digestive system, and then we're getting an expression of these organic acids that are accumulating in the body and then being excreted in the urine as a representative of what's happening in the gut. And so that would be markers 2, 4, 5, and 6. Tricarboxylic is actually linked to Fusarium mold. It's actually a common mold found in corn and corn products. That too indicates Fusarium colonization within the digestive system. And then we got the typical arabinose elevated that is linked to invasive candida. Citramolic is actually linked to Saccharomyces, mostly Saccharomyces cerevisiae, but Saccharomyces yeast, 3-oxyglutaric and carboxycitric just linked to just yeast overgrowth in general. So a lot of fungal markers, meaning yeast, including candida, mold, including Aspergillus on this profile. Probably the one that's most commonly seen or recognized is the arabinose because it is linked to invasive candida. I think it's a worthwhile sort of not necessarily having to memorize every single marker, but recognizing that these markers aren't always, or some of the previous tests that you might see if you go years back, will have Aspergillus or Fusarium mold designated next to that marker. So this is a perfect example. This was actually of a young child living in a home that had Aspergillus exposure. I use this lecture or these slides quite a bit in some of my lectures. And this was before Great Plains was actually designating markers 2, 4, 5, and 6 being linked to Aspergillus, but we can see everything is elevated. Number 2 is elevated, number 4, number 5, even number 6. Our arabinose at 118 is also high, indicating invasive candida. Now, what was interesting in this particular scenario is we have high Aspergillus exposure in the environment, Aspergillus colonizing the digestive tract, which is causing these markers to be high. And then when we looked at a MycoTOX profile, we can see that the ochre toxin was quite elevated, ochre toxin coming from Aspergillus. So it is certainly possible that colonization of Aspergillus in the gut can cause ochre toxin to be high. One of the other interesting side notes in this particular case is we had an extremely high level of oxalic acid. So oxalic acid, we could link it back to Aspergillus exposure, could also be linked back to invasive candida. Those are two possibilities, which was certainly the most likely cause in this particular circumstance with a very high level of oxalic. Could be diet driven. Typically though, somebody would have to be eating very high amount of oxalates to drive the level up this high. In this particular case, the vast majority of this oxalic was due to the fungal overgrowth scenario. And there is our arabinose, right? Arabinose indicating invasive candida, indicating its potential for oxalic acid production. And one of the other things in this particular case, when we looked at the Clostridia markers at the bottom of page 1 of the OAT, we had 3 of the 4 Clostridia markers elevated, which is relatively rare. The one most common is the HP-HPA, but we've got the creosol as well as the 4-hydroxyphenylacetic represented as well. Now, another mycotoxin that showed up was mycophenolic acid. This one's interesting because this actually comes from penicillium mold, a lot of times found along with Aspergillus. Mycophenolic is actually an immune suppressive chemical. They actually use it in certain pharmaceutical medications for transplant patients, like a kidney transplant, for example. It is immune suppressive in that it will inhibit the proliferation of B cells as well as T lymphocytes. B cells going off to produce antibodies, and then T lymphocytes could be T helper cells or T cytotoxic cells. If we take out our T cytotoxic cells, we're going to have a real problem because now we're going to be compromised against viral infections, for example. So it's known that mycophenolic could actually lead to just gut suppression of immunity that could increase proliferation of Candida and Clostridia in the digestive tract, which is actually what's happening in this particular case. And this is what Great Plains has seen now for years, is that those individuals who tend to have the highest levels of Candida or Clostridia markers or recurrent problems often have mycotoxins somewhere in the environment, likely just causing immune suppression at various levels as well as within the digestive tract. A couple other things to keep your eye out for when looking at the organic acid test that could be linked up to either mycotoxins, mold exposure, or even chemical or heavy metals. There's a lot of things that can drive lactic acid. We're not going to go through all of them, but serious conditions like hypovolemic and cardiogenic shock could be linked to lactic acid. But you always have to look at the test in the clinical context of your patient. Thiamine deficiencies are a known cause of lactic acid. But one of the things that really seems to be strongly linked is the presence of mycotoxins. So one of the things that I do when I see elevated lactic acid, I'm always suspicious that mycotoxins might be present. And so I'm always considering to do a MycoTOX profile. A lot of these mitochondrial markers can be elevated for various reasons. Okay, nutritional deficiencies, fungal toxins, chemical toxins, heavy metal toxins. It's difficult to know in many cases if there's just one specific cause. But I have seen mycotoxins elevate something called succinic. Now, succinic is actually linked to the electron transport chain as part of our mitochondria. It seems to have a stronger association with chemical exposure. So environmental chemicals, that could also mean heavy metals too. So if you see elevations of succinic, regardless of how elevated it is, just have a suspicion or a consideration to actually check chemicals as part of your next workup. Okay, so I can't say in all cases it would be from that, but just have that suspicion. When you see lactic, have a suspicion of potential for mycotoxins. As you can see in this particular case, this gliotoxin is extremely high, and gliotoxin will destroy our mitochondria or can at least greatly affect it. And this is, again, one of those things that the lab has seen over the years, is that those who have aspergillus or other mold exposure, okay, these two here are seen on page 1 of the 5-hydroxymethyl-2-fluoric and the furan 2,5-decarboxylic, are linked to aspergillus exposure in the gut. And when there is mold present, there's a very good chance that there might be elevated of lactic acid, because the mold is producing mycotoxins. The mycotoxins are causing interference in the body. Now, because of the presence of mold, we might also get elevations of pyroglutamic. And if you remember, pyroglutamic is linked to glutathione status. So as we get an increase of pyroglutamic, that is representative of a decrease of glutathione. And we would expect glutathione to potentially be low, pyroglutamic to be high as a representative of that in the presence of mycotoxins, chemicals, heavy metals, or just other chemical issues that we see off the organic acid test. That doesn't mean it automatically happens, but in general, the longer we have these kinds of exposures, the greater chance of a glutathione deficiency. So if you use sort of the 80-20 rule, which I typically use a lot in my lectures and my own practice of what I've seen, a good 80% of the time, when there is mold, when there is bacterial problems, when there is chemical exposures, you're going to see a glutathione deficiency. Now, I mentioned succinic, right? This is under the Krebs cycle metabolite section on page 3 of the OAT, okay? It often is elevated in the presence of chemical exposure, okay? It's not specific to any one, although xylenes tended to come up pretty high. But just have a suspicion that you might be dealing with chemical exposure. If the succinic is normal, that doesn't mean the person doesn't have chemical exposure. They still could have chemical exposure. You always have to, in order to absolutely find out what chemicals or mycotoxins somebody has, you have to do those tests. But if we were to use the OAT and just sort of increase our odds or increase the potential, succinic has, again, a strong link to chemicals, and we also have to consider heavy metals as well. Succinic is actually linked to complex 2 of the electron transport chain. Okay, so basically it's sort of affecting this area. So this is an interesting series of slides. This actually comes from a teenage boy with obsessive compulsive behavior, vocal tics. And actually this particular slide that you see is what we call a clinical data sheet. This actually comes from our Functional Medicine Clinical Rounds membership website. We have all of these one-page PDF documents that you can download that are profiles of different lab tests, different clinical markers that are part of this website. So in this particular case, we've got aspergillus exposure, very high gliotoxin, but it was interesting is that the organic acid test was normal. So let me blow these up. So the MycoTOX profile showed our ochratoxin to be significantly elevated, but look at the gliotoxin. This is the highest level I've ever seen, almost 140,000. That is a massive amount. Now, it turns out that this family lives in a 5-story apartment building. They're at the bottom floor, and they live in a country outside the United States, which I am always suspicious as far as the sort of the quality of the building, plus, you know, the ventilation system, plus the water systems that many of these buildings are vulnerable to. There is got to be some serious mold in their environment. Interestingly, nobody in the home actually has any respiratory symptoms linked to mold, but this is not a mycotoxin that's just being picked up by food. They also have elevations of mycophenolic, okay? So we know that it is immune suppressive. The Stachybotrys mycotoxins, the Riordan E, the Verrucorin A, these things are what are called trichothecines. It's sort of this chemical, very toxic mycotoxins. All these trichothecines have similar chemical structures. Stachybotrys is that black mold that's very, very dangerous. And by the way, there is no marker on the organic acid test that's specific for Stachybotrys. Okay, we've got those organic acids, 2, 4, 5, and 6, that can be linked to Aspergillus exposure, but there's nothing for Stachybotrys. And so in order to know exactly what kind of mycotoxins your patient is being exposed to, you have to do the MycoTOX profile. You can't skip it. You can't assume that somebody doesn't have mycotoxins elevated, okay, just because their page 1 of their organic acid is normal, which was exactly this particular case. As we can see, all of the mold and even the arabinose level is totally normal on the oat, but we've got extremely high levels of mycotoxins. And so why could that be? Why would that occur? Well, one of the things is that mycotoxins can stay in the body for very prolonged periods of time, months, if not years in some cases. And so it's quite possible somebody could be exposed to mold environmentally. The mold produces the mycotoxin accumulates in the body, stays in the body. The mold is either treated or they're no longer exposed to the mold itself. So the mold is no longer present, but the mycotoxin remains. So again, I've tried to emphasize this a lot. The organic acid test gives us a representation of gut colonization of mold, but it's not going to tell us anything about the mycotoxins of mold. You've got to do the mycotoxin test too. And I'd also encourage you to not just assume, just if you did have a situation where, let's say, the Aspergillus markers showed up, maybe 1 or 2 of them, and you go, oh, okay, so it's just Aspergillus, so not a big deal. That means they probably got some ochratoxin. Maybe there's a little bit of gliotoxin. Don't make that mistake either. I actually have a situation where somebody has a total normal looking page 1 of the oat, but they actually have Stachybotrys mycotoxins present. Now, in this particular individual, we can see that page 1 under the yeast and fungal sections were normal, but they did have some Clostridia. In fact, they had the most common Clostridia marker, HPA. And what do we know about these mycotoxins? Is they're immune suppressive. And so they can increase the potential for opportunistic bacteria, and including Clostridia and even Candida. So here is another individual with fatigue issues, headache, attention problems. So in this particular circumstance, what do we got going on? We've got marker 2 and marker 4 elevated. So I know I've got gut colonization of Aspergillus. It doesn't tell me where it's coming from. I just know it's there. We've got some invasive Candida. We also have an elevation of tricarboxylic. When the tricarboxylic is elevated, you know that Fusarium mold is in the gut. There's a particular toxin called fumonisin that when it exists in the digestive tract, you get this chemical called tricarboxylic that gets produced as a reflection of that. Okay, so we could look at a test like this and go, oh my gosh, this person's going to be loaded, absolutely completely loaded with mycotoxins. But that's not always the case. Okay, they do have some ochratoxin that would certainly be linked back to the Aspergillus. But if you compare this mycotoxin compared to the previous ones, okay, everything else shows nothing detected. Okay, so in this particular circumstance, it's not that the ochratoxin that they have is a non-issue, it is an issue, but really what we've got is a colonization issue of the gut, could be causing a lot of gut problems. but we don't have a massively burdened individual with mycotoxins. We still got to treat the mold. We could do some detoxification therapies like glutathione or N-acetylcysteine, for example, for the mycotoxins, but nothing like what we have to do for that first case where we have almost 100 and what was it, 130,000 on the gliotoxin. Okay, and then we don't have any evidence of any other mycotoxins here. So sometimes a lab test sort of de-emphasizes problems. And I think that's just as valuable. It's kind of helping us determine that, okay, this is, you know, this is something that we don't really have to spend tremendous amount of effort on. Getting a negative test sometimes is a useful thing too, so it allows us to know where to prioritize our efforts. So this particular series of slides I'm going to show you, I took from a lecture that's part of my functional medicine mastery course through Integrated Medicine Academy. So this is a very comprehensive course, a 16-module course with many, many, many hours of lecture material from a pure, you know, functional medicine standpoint. And I want you just to kind of go through these slides with me and think about what you would do. Okay, and so the idea here is that there's a patient coming to see you because they found out that you're doing functional and integrated medicine. So the main complaints are chronic headaches, memory issues, fatigue, depression. So the 59 years old female, postmenopausal, chief complaints of weekly, sometimes daily headaches described as pressure in the forehead radiating to the back of the head and neck area. There's no aura, no nausea, vomiting, no visual, motor, or sensory problems. Okay, fatigue problems for about 10 years. It is improved with rest, so it doesn't fit the criteria of chronic fatigue syndrome, not worsened by moderate exercise. Major concerns, or I should say major, but you know, concerns about memory. States she's becoming more and more forgetful over the past 4 to 5 years, but there is no family history of dementia. Moderate depression, some anxiety going back to her mid-30s. Now, she's on a couple medications, a daily aspirin, Lexapro for depression, Inderal, which is propranolol, which is a beta blocker that was specifically used for the hypertension that had been diagnosed 2 years prior. She's taken a number of supplements, calcium, magnesium, some melatonin, some glucosamine sulfate, and a multivitamin mineral. When she was 42, she had a right inguinal hernia repair, gallbladder removed when she was 48. Social history, smoked for many years. And she, you know, drinks 3 or 4 glasses of wine weekly. Okay, at this point, really trying to just work on lifestyle, swimming, golf, stationary bike, just trying to be more active. Physical exam, blood pressure, 125/70, pulse 60, no murmurs. Everything else checked out pretty good. They did see there are some surgical scars where she had the hernia and the gallbladder removed. So neuro exam, skin, extremities, everything else checked out fine. So here's the deal. This patient's coming to you as a referral from a colleague, okay, because they found out that you've been taking some functional medicine courses and kind of working in this area, so they need some help. Okay, so it's known that you've taken these courses, and so they're looking to say, hey, maybe you can help with some looking at things from a different way, some different lab test considerations, supplements. So the patient arrives with the various tests that were done by another practitioner, but they're coming to you for interpretation, clinical correlation, and some other ways of looking at things. They just kind of felt like the last practitioner didn't properly explain some stuff. So you got to decipher the information and develop a game plan. Okay, so let's play that. So here's the oat. Okay, what do you see on page 1 of anything of significance? Okay, I don't really see much to speak about here. Okay, so everything looks pretty normal, right? So we can look at this and say, okay, we're not really dealing with a fungal issue. We come down to the bottom of page 1. The bacterial markers look normal. The Clostridium markers look normal too. Okay, so nothing to get too excited about on page 1 of the oat. We flip the page or go to page 3, We've got oxalic, right midline, okay, right at the mean line. And then our glycolic and glyceric are low as well. The low glycolic has very little known clinical significance. So nothing much to speak about in the oxalate section. Not a lot going on in the glycolytic and Krebs cycle section either. Okay, so again, most of these markers are really truly only significant when they're elevated, meaning they're above the second standard deviation line. Here's the first standard deviation, second standard deviation. So if you get above that second standard deviation, that marker gets wrapped in a red diamond. Okay, so you could sort of pick apart these, but okay, in general, not a lot of significance. Now, under the neurotransmitter, it's kind of interesting because there's nothing elevated, but we'll kind of notice that our homovanillic acid and our vanillidylic acid are low normal. Now, in some cases, this could contribute to attention problems, to memory issues, because homovanillic linked to dopamine, vanillidylic linked to norepinephrine and epinephrine certainly could be linked again to attention focusing memory plus energy. So it kind of makes you wonder why these are so low. You'd have to dive into the biochemistry a little bit closer. It could be an input problem, meaning you're just not getting enough precursors like phenylalanine or tyrosine. Perhaps you got a B6 deficiency that's inhibiting the ability to make dopamine, for example. We can really get into the weeds here with this in that sometimes you can have certain chemical exposures like organophosphates that can actually cause low levels of dopamine and norepinephrine as well. So that might be a possibility in this particular circumstance with these low values. I do think these are significant, even though they're not wrapped in a red diamond from the lab. You have to think about it clinically and critically here to think, why would these be low? Now, this person's on Lexapro, which is an SSRI. It's a serotonin reuptake inhibitor. You might think that that actually might inflate the serotonin marker. Okay, so maybe they're just not getting a lot of clinical benefit from it. You wonder actually how useful it actually is. Not much to speak about under the folate metabolism. This actually has a link to the methylation cycle. A couple markers show up under the fatty acid and ketone section. None of the other markers are elevated. It's not as though these are like really high, but it is a little bit suspicious that you've got these keto acids. So these are actually ketogenic markers. Okay, that could be elevated because of ketosis. That could be somebody doing a ketogenic diet, high fat diet, or they might indicate some kind of insulin resistance, some developing problem of glucose intolerance. So that's something to consider, okay? Because we don't have any other elevation of any other fatty acid here. So it kind of begs the question, why are these elevated? When we look at the nutritional markers, remember there's 4 markers that have an asterisk next to them: methylmalonic, glutaric, 3-hydroxy, 3-methylglutaric, and methylcitric. When these are elevated, it indicates a deficiency of that respective nutrient. Okay, we don't have any of these asterisk markers that are elevated. Okay, so we don't have a deficiency of those nutrients. Our B6 is low, that's fairly common, and that might explain, at least in part, some of the low values in the neurotransmitter section. Our ascorbic is low, that's actually very common. It's an unstable acid in urine samples. Many organic acids are low in ascorbic acid. It doesn't mean the person has a vitamin C deficiency. Okay, the main reason the ascorbic acid is on the test is to pick up on normal levels or potentially high levels. You cannot make a determination of vitamin C status from the OAT. When it's low, I should say, when it's low. So, some B6 potential there. That's something to consider. Indicators of detoxification, okay? Nothing under the ammonia excess, nothing there under the 2-hydroxyhyperic. Remember, pyroglutamic, when elevated, indicates a glutathione deficiency. Now, there's another one that has an asterisk, the 2-hydroxybutyric. There's multiple reasons that this can be high. The most common one is that the body is attempting to make more glutathione because it's under demand, under stress, to try to keep glutathione status normal. That would be the most common scenario. But there is one other thing to look out for. You'll notice that it's, modestly elevated. It turns out 2-hydroxybutyric can also be elevated for the same reasons that cause the 3-hydroxybutyric and the acetoacetic found under the fatty acid ketone section to be elevated, meaning it can also be elevated in ketosis. In fact, 2-hydroxybutyric is another marker that's often used for glucose intolerance. And sometimes they'll actually look at it with regards to what's called diabetic ketoacidosis. So I want you to think about all of that in sort of the what would you do next scenario. The amino acid metabolites, phosphoric. Okay, we know that low normal levels of phosphoric are commonly associated with a need for additional vitamin D. Okay, so that could be something we could look to do here. And then the amino acid metabolites are all normal. Okay, remember this part of the organic acid test is only significant when the levels are elevated. This is the oldest part of any oat. These are markers linked to genetic diseases, what are called inborn errors of metabolism, mostly in children. It's actually normal to have 0 levels. It basically tells you there is no metabolite that is accumulated because of a downstream enzymatic block. This does not represent, an amino acid deficiency. Okay, it basically tells me that this person doesn't have a genetic metabolic disease of these inborn errors of metabolism, which is actually a good thing. So these are some intervention suggestions based on the oat, right? For me, I'd look and say, okay, this person, by the way, was already on some multis, but let's just say you were going to maybe replace those, you didn't like the look of them. A multivitamin, multimineral, just to start filling in the gaps nutritionally, some essential fat, some cal-mag citrate. I wouldn't have a problem giving some vitamin C, certainly wouldn't have an issue giving some B6. Probably worthwhile to add in some tyrosine and phenylalanine, see if we could boost up those dopamine levels that way. I'd also want to get a diet diary, just to say, okay, what are you eating over a 5-day period of time? Person also comes in with a GPL-TOX. So this other practitioner actually did a lot of testing. The GPL-TOX, which is called the toxic non-metal-chemical profile, shows a huge amount of this 2-hydroxyisobutyric, this MTBE. This is added to gasoline to improve octane ratings. This is a massive level, okay? Probably one of the highest I've ever seen. So that's certainly a problem, and it's important to think about it in the context of this patient. It has central nervous system toxicity. Okay, it can lead to peripheral neurotoxicity as well. And by the way, on these GPL-TOX profile, things are getting most significant when you're getting above the 95th percentile. Our styrene is very high. Okay, it is also a toxin in the central nervous system. It can cause concentration problems, fatigue, nausea. This person is having memory issues. They're having fatigue issues. This one is linked to plastics, can also be linked to car exhaust fumes. By the way, another thing you always want to get from patients is where do they work? What are their hobbies? That can be very revealing as far as some of their chemical exposures. Nothing really of any significance on this page, from the benzene to the perchlorate, for example. Not much to speak about here either. Propylene oxide, a lot of people are exposed to it. It's a fumigant used in plastics. So sometimes plastic, food that's wrapped in plastic, for example, you can show elevated propylene oxide, but it's not above the 95th percentile. The acrylamide certainly could be a potential problem. right? It's right at that 95th percentile. So I don't want to say that it isn't. Plastics, food packaging, drinking water. Okay. Again, it causes neurological issues. Sometimes you'll see this elevated in kids who eat a lot of French fries or just fried food. Watch out for anybody who smokes cigarettes or the potential of secondhand smoke. I've actually seen that actually occur on more than one occasion in a child actually who's being exposed to secondhand smoke. The 1,3-butadiene, something that is often associated when the styrene and the MTBE is elevated. This has cardiovascular issues. You see this a lot in kids. Used to see it a lot more before COVID, but you see it a lot in kids who play on athletic fields, the synthetic sports fields, soccer, football. So it's because the little rubber beads in these fake fields anymore, they have 1,3-butadiene in them. Organophosphate, modestly elevated. Okay, so there could be some work to do there as far as exposure. Not much to speak about here with the 2,4-dichlorophenoxic acetic acid or the pyrethroid insecticides are normal. So these would not be having any kind of associated issues as far as this patient's symptoms. What is very curious is this last marker called Ti-glycine. Ti-glycine is a marker of mitochondrial damage, typically at the DNA level. Now, one of the things that's always difficult to know with any of these tests is how long have these markers been present, right? Particularly if this is just the first go around. I have no idea how long this Ti-glycine has been present. It could be caused by infection, inflammation, chemicals, nutritional deficiencies. I think it is a problem. Okay, and I'd certainly want to follow up with this GPL-TOX profile in 90 days after whatever intervention we do, because I want to see if this is normalizing. To me, this is a person that could benefit from additional antioxidants. So if we think, just a quick overview of the mitochondria, right? The mitochondria have the two membranes, the outer and the inner. Then we've got this intermembrane space. So intermembrane space sits between the outer and the inner membrane. We've got a pumping mechanism that as we transport electrons, right? So electrons move from complex 1 to complex 2 to complex 3 to complex 4. That causes an electrical gradient effect, allows for protons to be pumped out into the inner membrane space. And then eventually these protons accumulate over the top of what's called complex 5, also called ATP synthase. And as those protons move through, it causes a binding effect between ADP and inorganic phosphate to make our ATP. So a lot can interfere along the way. We can have things that take out complex 1, complex 2, take out our Krebs cycle. All of that could compromise ATP production. So the Ti-glycine is actually linked to the respiratory chain, another name for the electron transport chain. The electron transport chain is just that. We're transporting electrons through a chain reaction from one complex to the next. At the same time, we're pumping out protons into that intermembrane space to ultimately make large amounts of ATP. Okay, and it turns out that Ti-glycine becomes elevated when we're interfering with complex 1 of the electron transport chain. Now that could occur either because we're not getting good activation because of a chemical called NADH. Could also have a severe CoQ10 deficiency. So what are some other intervention suggestions that could be based on the GPL-TOX profile? Well, one thing that somebody simply could attempt to do is home water filtration, just making sure they're drinking purified water. And they could also filter their water for personal use outside the home. Okay, particularly if they're not sure of the quality of water at their office, for example, if that's where they go. We want to make sure they're emphasizing organic food, eliminate food that's wrapped in plastic. Okay, in this particular case, that's sort of the minimum. And then antioxidants, for example, so vitamin C, glutathione, NADH could be worthwhile just to boost mitochondrial activity. Now, sauna therapy can be very helpful for chemical exposure. That could be infrared sauna at home. It could be a health club sauna as well, if they, as far as an external heat sauna, if somebody can't either afford a sauna at home or they don't have room for it. One of the things that can also help people, now this person, remember, they do have some fatigue, but they're not worsened really by moderate exercise, and their fatigue is relieved with rest. So it's not a chronic fatigue kind of situation where they have massive interference in daily activity occurring on a daily basis longer than 6 months. Exercise, right? Get the body moving. Because one of the things that exercise will do is it'll increase sweat. And sweat is one of the ways that we can get rid of a lot of these chemicals. So I'm a huge advocate of consistent exercise, at least 5 times a week. Try to do weight-bearing exercises, 30 to 45 minutes per session. A lot of people can work out at home. There's some great programs at home, great programs online. We're members of something called beachbody.com, which has unbelievable programs. I think the membership to Beachbody online is less than Netflix. It's like $7, $8, like $9. Forget what it is. Okay, but this helps to also detoxify. They came in with a glyphosate profile. Now, most everybody I see, particularly here in the United States, has some glyphosate. Unfortunately, it's just something that's sprayed all over the place. So we can avoid it through organic food consumption. Organic foods, and avoiding GMO foods. Try and avoid, obviously, the use of it on our own lawn. And then increasing sulfur-based foods, onions, garlic, broccoli. Okay, this helps to get rid of glyphosate in the body. Epsom salt baths could also be an option as well. Now, this is a little bit older profile of the GPL mycotox, but I think it highlights the point here. So they came over the MycoTOX profile. So we've got okra toxin that is present. We've got some gliotoxin that's present. So you know that there's been some aspergillus exposure because we're seeing the mycotoxins that were produced by the aspergillus. So that doesn't necessarily mean the aspergillus has to be still around. It could be. And we've got the sterigmatocystine and the mycophenolic. Okay, so this is representative of penicillium. So penicillium is often found along with aspergillus environmentally. These last two, and I even have a hard time pronouncing this one, this chiodoglobulin A, that's a tongue twister. Citrinin, interestingly enough, can occur because of aspergillus and penicillium exposure. So that many times is seen when the okra toxin or the gliotoxin or the mycophenolic is present. There's another one called monascus, I think is how it's pronounced. I've actually never seen that before. That can produce citrinin as well. But these two guys, just these two, by the way, should really raise a red flag suspicious of environmental exposure. If I'm pronouncing this right, this chiodoglobulin A, okay, some of the studies have actually shown that upwards of almost 50% of its present is due to water damage in the home. This person has enough mycotoxins to me to say they need to have minimally their home analyzed for mold. I have seen situations where people were being exposed at work. I actually have some cases in my practice where kids were being exposed at school. And there are cases, actually, people having moldy vehicles. So, for example, they got water damage, and that could occur even just in the air conditioning and the heating systems too in cars. So what are some intervention suggestions based on the mycotox? Well, yeah, make sure they're checking for moldy food in the refrigerator. I don't anymore, but I've bought some. I remember one time buying some, I think it was grapes at a big box store. And, I didn't have my glasses. So I get home and I open it up, there's mold at the bottom. I just toss the whole thing away. Berries are notorious for having mold. So, the thing is that trying to buy those things individually and keep them contained, in glass containers, for example, or airtight, packages at least. Keep rice, other grains stored in airtight containers as well. But in this person, really, they need to minimally have their home inspected. And there's a couple of good companies out there, I think, that do a good job as far as some in-home mold kits. EnviroBiomics has a good panel, their ERMI panel. I've seen a few from Immunolytics. That's another company. Most of these people can order on their own, which is kind of nice. I mean, that's a whole other broader discussion to get into assessing the home. But in this particular case, at least from what we can see on these tests, that's something that should absolutely be done. And then there are some additional considerations. Okay, if this person hasn't, they should have a comprehensive blood chemistry profile. Look at thyroid, look at anemia, look at lipids. I'd want to look at serum glucose, look at serum insulin, hemoglobin A1C, just to check, because we're seeing an elevation of those ketogenic acids under the fatty acid ketone section of the oat, plus the 2-hydroxybutyric was elevated too. We could look at heavy metals. I always like doing a hair metal test as a screen, just to see what exposures are. Look at certain mineral deficiencies too. Lithium deficiency oftentimes correlates, I feel anyway, with people's symptoms. Salivary cortisol and DHEA to me would be worthwhile to do, just purely from a fatigue issue and depression. Look at a stool test. And then ultimately trying to get them off the Inderal. It may be that the Inderal could, at least in part, be causing some of the fatigue. Those beta blockers are notorious for doing that. In fact, we had a case years ago of a guy who was a minor league baseball coach and kind of a stressed out guy, and was on medication, high blood pressure medication. It was actually a beta blocker, and it was appropriate for him while he was coaching. But then he retired, and then couldn't figure out why he was fatigued. It turned out that it really didn't have anything to do with underlying biochemical imbalances. He was fatigued because he was no longer stressed out being a baseball coach, but he was still taking the high blood pressure medication. And so it started to affect him because he didn't need it anymore. And that was the fix. So sometimes it can be medications that people are taking that are contributing to some of their issues. I think in this particular case, as with many people, health goals, right? Improve the quality of diet. That can help eliminate toxin exposure. Exercise, not only good for the physical body, but mental focus, concentration. Okay, adrenals come back, work on that. There's always things we can do from a lifestyle standpoint that could be helpful. And then again, right, eventual elimination of the high blood pressure, as well as the antidepressant medication. It's probably not likely that Lexapro is doing much for this person anyway. So these are kind of case scenarios that, there's hundreds of these kinds of things that we work with in our practice. And so what's important, I think, when you're thinking of comprehensive lab testing, including the organic acid test, which is just a profile in itself, but incorporating the GPL-TOX, incorporating mycotoxins or other kinds of lab testing, it's always important to think critically and think clinically, applying the information to the clinical presentation of your patient and trying to piece things together that way. Now, we have a number of courses through our Integrated Medicine Academy. We have an essential oat, which is just the foundations, the fundamental aspects of oat interpretation and incorporation into practice. And then our advanced oat mastery course, which we go through every single marker on the oat test in a very in-depth way. That course actually is currently available. Both are available, but the advanced oat mastery course is, we're currently involved in doing that live. You can get more information at advancedoatmasterycourse.com. Our toxicity mastery course gets into these topics in a very in-depth from a chemical, metal, mold, mycotoxin, detoxification standpoint. So more information about our toxicity mastery course, you can go to toxicitymasterycourse.com. We have a new course starting in October 2021. So coming up here. If you are a healthcare practitioner and you would like to interact with myself or my partner, Dr. Trincatella, doing lab interpretation, case presentation, troubleshooting, clinical pearls, join us at functionalmedicineclinicalrounds.com. This is a membership site. This is not a course. It's a membership site. But we do one-on-one lab consults, practitioner consults. There's also educational material. There are educational videos. There are those clinical data sheets, those one-page PDF documents on test interpretation. We also have a member forum as part of this website too. If you're needing assistance with lab testing, okay, there's a website called Lab Test Plus. Lab Test Plus provides access to a lot of the Great Plains tests, including the organic acid, GPL-TOX, MycoTOX Profile, metal testing, and more. And when the labs come back, the results are sent to us for written interpretation of the relevant findings. More information, you can email to labtestplus@gmail.com, or you can look at the menu of labs right from the website at labtestplus.com. For more information about any of our courses, our mastery courses through Integrated Medicine Academy, you can go to integratedmedicineacademy.com. You can also email us directly for any questions there, okay, at integratedmedicineacademy@gmail.com. And then I'm also available for private consultations through my private practice, Sunrise Functional Medicine. There's the email, there's the phone number. So again, I want to thank everybody for your attention. I hope this was useful for you in going through some examples of the MycoTOX GPL-TOX profile. It's all interesting information. There's a lot to know about these. Just, keep asking questions, keep digging for information. The more you do this, the better you get, and the more we can help our patients. Thanks so much. I'm Dr. Kurt Woeller. Everybody take care.